We welcome you tonight to the Nutrition and Dental Health webinar, sharing with you the eminent panelists that we have tonight. We have Dr. Imran Junaid, Dr. Nipa Said, Ghazala Arsiwala, and we have Veena Uttararwar. I would like to now welcome Dr. Imran Junaid.
Hi, good evening, everybody. I wanted to start off by thanking my Cracking the Wellness Code team, as well as my fellow panelists for putting together this really amazing program tonight. So I'm excited to share my insights regarding the microbiome, oral health, and its pertinence in immunity. As an introduction to myself, I am board certified in internal medicine, allergy and immunology, as well as obesity medicine. I help run a medical group in the East Bay. We have 3 offices and 8 providers. And we have a multi-specialty group that focuses on primary care, allergy, sleep medicine, diabetes, endocrinology, and functional medicine as well. In addition to that, I also am the Chief Medical Officer of Digby Health, which is a digital informatics platform where we harness the power and knowledge of our DNA as well as a microbiome to help create a tailored dietary intervention to reduce inflammation, improve outcomes in obesity, diabetes, and other chronic illnesses. Let me begin here. So if we can go to the next slide, please. There has been a tremendous shift in our thought process regarding how we think about ourselves as a being. Leonardo da Vinci made this famous diagram, the Vitruvius Man, and it basically, at that time, the thought process was that the human figure was the soul encompassing, most beautiful, unique, and artistic shape that existed. And that we have been, over time, a very much human-centric type species where we tend to believe that everything that is human is the only thing that is unique and powerful. And over the course of millennia, we've, as our scope of knowledge has increased, we've learned that the Earth is not the center of the solar system, that our solar system is not the center of the galaxy, our galaxy is not unique, and that there's many, many layers and aspects to our being that we encompass. And what we have come to realize is that there are trillions and trillions of bacteria that co-inhabit with us and that are important for our immunity. So next slide, please. What we see is that we are actually a superorganism as a human being. We have somewhere around 10 trillion cells that make up all of our organs and all of our substrate that are composed of 23,000 genes. However, there are over 100 trillion bacteria that co-inhabit with us as this superorganism. And collectively, there's around 3 million genes that are present with these bacteria. So they far outnumber genetically as well as functionally what we are as an organism, and how we interact with this microorganism, our human cells and these microorganisms, is what leads to health or disease. And that concept is fairly fresh and is only about 15 years old at this point. The science that enabled this to happen just came to realization in the late 90s and early 2000s. So this is a very hot and emerging topic, and we're learning more and more about it. Next slide. The microbiome is very important and it affects every single aspect of our health, between bone regulations, skin disease and health, nervous system development, how our blood vessels develop and modulate injury, how we deal with fat storage, if we get obese or not, how we modulate nutrition, the type of bacteria we have ultimately leads to the amount of energy that we end up utilizing between from our food. And in the scope of today's talk, next slide, please. We talk about how the microbiome is extremely important in gut in oral health as well, and how that oral microbiome specifically can then ultimately affect the rest of the microbiome in our gut and elsewhere, and how it can, if that is imbalanced, that can lead to disease such as dental cavities, gum disease, can predispose to development of cancer, as well as disrupt the other metabolic pathways in our body, leading to obesity, development of diabetes, liver disease, pancreatic cancer, and colon cancer. This is still a very much emerging topic, and given the time that we have, I'm not going to dive too deep into the microbiota aspect of it, which bacteria are off and which ones are not. But the key principles here that I think would be helpful as an introduction are that there are somewhere in the range of about 500 species of bacteria that live in our mouth. And if they're balanced, our teeth and gum remain balanced. And that translates to signaling pathways in the rest of our body, which can key into health or not health. And there's really fantastic data around dental health and risk for cardiac disease. So plaque formation in the arteries of your heart and in your neck that can predispose to stroke or heart attack can be worsened if you have the wrong kind of bacteria. What is interesting here is, unlike bacteria in the gut, where food intake can make a critical difference in terms of how we change things with prebiotics and probiotics, really the care for the mouth is what's more important. So proper oral hygiene, which my colleagues will talk about a little bit more, avoidance of tobacco smoke, avoidance of chewing areca nut, because those can greatly disrupt the microbiome of our oral cavity, which then predisposes us to development of cardiac as well as cancer risk. Next slide, please. As an immunologist, I do want to raise and bring to attention sort of the elephant in the room, which is what we're all dealing with as a collective human species, which is how coronavirus has greatly affected our lives, have really turned our society upside down, and a lot of the mechanisms that we have to socialize, anxiety, to talk to each other, to leverage each other, have greatly been strained by this virus. And I'd like to echo sort of the recommendations that are present on the CDC website, which paramount is very much about social isolation. Staying at home is very, very important so that we limit the spread of this virus. Sanitizing things that come into your house, the grocery bags, especially the plastic coverings and other materials, the mail and those kind of things. That's an important thing, conduit for viruses coming in. Wearing masks outside, as easy as a bandana or a face covering. There's many different options online about making your own mask, and ultimately washing your hands. These 10 little digits that carry viruses all around are very, very important. Next slide. Because of our California's early intervention with social isolation and awareness, we have really bent this curve down. And there's a lot of data that gets thrown our way about how many people are in the hospital, how many ICU beds, and what your curve looks like. Realistically speaking, the main thing that we have to look at here is the incidence of disease or the morbidity or the death rate per population. So we are sitting right now looking very good as compared to the rest of the country. We're 0.2 deaths per 100,000 patients. That is below average for America. If we go to the next slide, the worst case outcome is actually happening in New York right now because of population density and other social measures that were not adhered to. they're seeing a 4 daily deaths per 100,000. So that is a 20 times worse case scenario than in New York as compared to California. And all this is doing it is just buying us time here, so that if we don't continue to do the social distancing, isolating, and limiting the spread, next slide please, what we are ultimately getting to is that cure will be the vaccination. And that is a key thing that we have to sort of establish here, is that the best case scenario is that we all get vaccinated so that we have herd immunity in place, so that the majority of the human race does not get infected and deal the burden of disease that we will do. So we're buying the time till we get to that point. And I'm happy to talk more about either one of those aspects further, but I'm going to arrest my time here and pass it on to the next panelist, so that's okay.
Thank you so much, Dr. Imran, for giving us all the tips on COVID-19, the protection that we need. And these are unprecedented times that we are in today. So all the information is highly valuable. Thank you so much. I would at this time also encourage all the participants to please put your questions down in the chat box after each speaker has their time. We would open up the question or Q&A series, and then we would encourage all of you to have communication open with the panelists. Moving on to our next panelist, Dr. Nipa Say. I would like to welcome her now.
Hello, Ankita. Thank you for having me.
Thank you, Dr. Nipa. So the audience would love to hear from you now.
Sure. Firstly, thank you, Dr. Imran, for that very informative session, and thanks to my fellow panelists. My talk today would be mostly about prevention of dental disease. In these times, we want to avoid, going out as much as possible. Dentists have been advised not to practice dentistry for obvious reasons. Prevention in dentistry starts at home. In dentistry, your prevention starts with your toothbrushing techniques. And what I'd like to first address is why this is important. Dr. Imran did allude to it a little bit. I wanted to go into a little more detail about why your dental health is extremely important. In short, your dental health is related to your overall health. The bacteria in your mouth are directly responsible for your cardiac health, as has been proved, and vice versa. Where if we see a patient who's had severe high blood pressure, hypertension, any kind of cardiac disease, and has gingival disease or periodontal disease, it does get their heart ailment is exacerbated. Same with diabetes. If you have a diabetic who has severe gum disease, it's going to be difficult to control the diabetes until their gum disease is under control. We have also noticed in pregnant ladies where if their oral health is not hygienic, or if they haven't had good periodontal health or gum health, then the chances of a late-term miscarriage is quite common. This and of course, Dr. Imran did tell us about the correlation between your dental health and the gut biome. So given all this, we know now how critical it is to take care of your teeth. And, that being said, let's talk about what it is we can do to prevent gum disease and caries or cavities. One of the first things that we can do is our home care. Our home care should involve good toothbrushing techniques. One of the things I absolutely recommend a person do is throw out your manual toothbrushes and get your electric toothbrushes. This is the single most important change you can make today in your daily, care for your teeth. An electric toothbrush does clean your teeth about 10 times more. It does remove plaque about 10 times more than a manual toothbrush. There are various toothbrushes out there. Take your pick. There are some that have sounds and lights and all sorts of things, but you can go for the basic one. But that's my recommendation, an electric toothbrush for sure. Toothpaste, which has fluoride in it, if you have children above the age of 3. Below the age of 3, fluoride is not recommended. So every other person should be using a toothpaste with fluoride unless otherwise recommended. And so that's with your toothpaste. And then in addition to that, I would recommend cleaning your tongue with a stainless steel tongue cleaner. Now the last thing, which most of us hate to do, is the dental floss. And why is that important? If you've noticed, our teeth are extremely closely spaced together. Our toothbrush just simply cannot reach between teeth. So if you're doing everything I just mentioned and doing it twice a day as you're supposed to do, you're still not doing 100% of the job. You're barely doing 80% of the job. So you do need to floss between your teeth to remove all the food particles and plaque that's collected in between your teeth. Now, as far as prevention is concerned, one other missing element is also visiting your dentist twice a year to get your teeth checked and get your teeth cleaned and make sure that you're free of disease. And if you're not, then to follow the recommendations provided. Very often in my office, when we give options to patients for treatment, a lot of patients do opt for the easier treatment, which is an extraction of a tooth. And I believe the thought process behind it is, oh, I have 32 of them. It's okay to lose one. I'm not going to be losing too much function. And they're not wrong in thinking that. What we are wrong in thinking is that those 32 are not linked to each other. Losing one, you are going to have a domino effect on the rest of your teeth. So as far as possible, please follow your dentist instructions, no matter what, to try and save your tooth as much as possible. And if it's simply not possible, then go ahead and follow recommendations to replace the tooth after the extraction. I think for today, I think this is what we have. And a friend made an interesting observation with COVID that given these times, you want to visit your dentist less. So prevention is obviously the key. However, dentists are doing tele-dentistry. So if you're in pain, please do contact your dentist or the American Dental Association, and they will forward you to somebody who can prescribe or help you out temporarily at least. So thank you for having me, Ankita.
Thank you, Dr. Nipa. Thank you for sharing that we do have an option for tele-dentistry. So I'm sure a lot of us weren't aware of it, and everybody's worrying about their dental hygiene now that it's difficult to get access to your dentist in these difficult times. Also, I loved your suggestion about using a tongue cleaner. I remember using it as a child, and after such a long time, I've heard the recommendation that include a tongue cleaner, not just the floss, but do use a tongue cleaner. So thank you for that.
Sure, absolutely, my pleasure.
All right, thank you. Our next speaker I would like to invite is Ghazala, who is the co-founder of Happy to Be Healthy. Hi, Ghazala, welcome.
So hi, everyone. I'd like to begin by thanking ICC and the CWC team to get us this opportunity to share some information with you on steps that we can take to limit our exposure with the foods that we eat for this current situation. I'd also like to thank my fellow panelists. It was very interesting and enlightening to listen to both Dr. Imran and Dr. Nipa. So thank you for sharing those insights. And I'd like to begin by introducing myself. So I'm a master's health coach, and I do run a startup along with Ankita called Happy to Be Healthy, where we primarily do nutrition-based workshops for both adults, seniors, and also for children. And we are associated with the Cupertino School District in the area. To begin talking about why we are here today is we are going to talk about food and its relationship to our overall health. We do our best every day to be healthy in our own way. And we need to pay closer attention to what we eat because it's directly related to how we feel, and it also helps with our immunity overall, as you've heard a little bit from the other presenters. These are difficult and uncertain times, and we can cure COVID, but what we could do is we could take preventive steps to limit its exposure and hopefully to recover from the disease if we are already suffering from it, which many of us might be. So while there's no cure, there are some steps that we can take, and these are the 4 Ps that we propagate in order to prevent this illness. The first one is to preload, which is basically feeding your body the right fuel to equip it with the right immunity. The second one is to prepare. We need to hope for the best, but be prepared for the worst. That includes, stocking up on your pantry essentials. Prepare, don't hoard. And the other one would be protect, as most of us know that COVID is spread through droplets that remain in the air for a few hours. And, you see this little emoji out here with a mask on. CDC's current guidelines are they're recommending us to wear a mask, when we step out. It's more for, I guess, the people who actually have the disease than the ones who are afraid of getting it, because it kind of, contains the germs and you don't spread it. So in any case, it's not a bad idea to protect your face with a bandana or cloth or whatever you do have, if you're just walking out and you need to get out of the house. So make sure you protect your face and cover your nose. Lastly, the P is for panic, which we must not do, because when you panic, you dial down your immune system, and that depresses your immunity. And we all know that when we are in a state of panic, we don't make wise decisions. So it's very important to stay calm and keep going. All right, next slide. So let's pause and think about the little and big things that, we are truly grateful for, especially during this pandemic. Being at home for the last month has made me think about a lot of things that I'm grateful for, which I never have time to think about in our daily race of getting things done in life. I'm grateful for, of course, the first responders, who in this country are, so sacrificial. I'm grateful for technology that allows us to keep us going. We're grateful for, of course, our family, the love and support of our friends. So there are so many things in life to be grateful for. So I think it's really important to reflect back now that we have the time to do that and practice some gratitude. And on that note, I'd like to share a letter that comes from a COVID patient who experienced this illness in China. And I'm going to read aloud the letter. This is from a Chinese teacher, and this is what she says. As the world begins their time inside and you realize that you have no control over the situation, let go of any thoughts of trying to plan for too much for the next month or two, as things change so fast. Don't be annoyed and angry at the system, which will only help you get your anxiety down. You make the best of the situation, whatever that might be for you. Accept that this is what it is, and things will definitely get easier. Appreciate this enforced downtime. You learn to appreciate the little things, like sunshine through the windows, flowers blossoming, spending time with your family. To those beginning this journey, you will get through it. Listen to what you are told, follow the rules, look out for each other, and there is light at the end of the tunnel. So that's what she had to say. So we must always continue to be hopeful, because that's the only way out. All right, next slide. Okay, so you would see a bunch of things out here. So we believe in the 4 pillars of health, and we advocate our philosophy through lean. And I'd like to share that, healthy is not just about what we eat or how much we exercise. Healthy is actually, being healthy is a combination of a couple of things like lifestyle, exercise, attitude, and our nourishment that we get through nutrition, how these combine together to positively or negatively affect our behavior, our energy levels, our ability to learn, and so much more. Coming to lifestyle is basically how we live our life. Unfortunately, today we have to practice physical distancing, where we are not allowed to mingle with friends and family, but that doesn't have to weigh us down. There are other ways to keep up with your connections, and we could still have a good, connected life by phone calls, text messages, and things like that. So, we can define in our own way how we would like to live our lives. An important tip that I'd like to share with you that you might want to try, since we're all trying to build our immunity here, is to when you get up in the morning, have a glass of warm water and squeeze a whole lemon in it, because lemon is obviously very high in vitamin C. It has high pH levels, and we know that COVID has pH levels between 5.5 and 8.5. So when you take foods that have higher pH levels, they boost your immunity. So try that, a glass of warm water with some lime. I will move on to exercise. Exercise is so important because it helps improve our quality of life. It helps us lead a longer life, a fuller life. And just because we're sheltering in place, that doesn't mean we cannot exercise. Exercise could be done even at home. There is something called isometrics, which some of you might have heard about. It's simply holding and flexing your muscles. So you could do that even while sitting down. So it's very important to keep moving, and whatever that might be for you, but make sure you get your bouts of movement throughout the day. The tip that I'd like to share out here is whenever you get to make your tea or coffee, try doing 15 squats every time you do that. So, and see the energy level that you get after doing that. So that would be the tip for exercise. So you don't have to program a whole hour. Even if you can get your bouts and do little things, that adds up at the end of the day. Moving on to attitude. Attitude is simply, having a mindset where you see and you recognize opportunities. We'd like to term it as having a Zen attitude, where you think of life as something that is not happening to you, but that something that's happening for you. And even in adverse situations, we try to learn from them and see, how would this make us a better, more enlightened being. So that's called having a Zen attitude, where you actually turn it around and think of it as an opportunity. There are lots of things we could do to keep that positive set of thoughts. I'd like to make a playlist where I put in different melodies, and that is always a mood enhancer for me. So you might want to try that. Just create your favorite song playlist and see how that works. It definitely lifts me up on days that I'm down. The last bit of the lean piece would be nutrition. Now, nutrition is a very important factor in our overall well-being. And you might be thinking that, oh, do I have to eat any special kinds of foods in order to stay healthy? And what's the secret? There really isn't one. There are no special foods, but we do encourage you to have a diet with real foods, which is whole grains, legumes, beans, fish, lots of colorful fruits and vegetables, nuts. And one important thing I'd like to make a mention of in nutrition is to get enough protein. especially as we age, we need protein for the repair and recovery of our cells. And as we age, there is a risk of sarcopenia, which is basically a loss of muscle mass, strength, and function. And you want to make sure that you have adequate protein so that your cells have enough time to repair and recover themselves. And I would think about 15 to 25% of your your daily calorie intake should come from proteins. And in order to get that in during your day, you might want to try maybe a spoonful of flax meal powder in your smoothies or in your daily chapatis, or even having a handful of nuts if that's just something easier for you to grab. How we live our life, is dictated by a combination of all these 4 foundations, which are lifestyle, exercise, attitude, and nutrition, and they combine well to keep us going forward and keep us going for long. Next slide. So this is just a quick one on boosting our immunity, since we were talking about food and our health. So I just want to give this away. Top 3 fruits overall, if something that comes to your mind, it would be, for me, based on research, we have papaya, because it's very good for digestion, and it's loaded with vitamins and minerals. The other fruit would be avocado, which are high in omega-3s, very good for your heart health and also your vision, helps with the risk of depression. And the third fruit would be guava. Those are the top 3 fruits. Guava is also very rich in manganese and potassium. That potassium is a good source of regulating blood pressure. What are the best expectorants for a cough? Natural expectorants would be radish. Radish is very rich in vitamin A and C, and is also known to have anti-congestive properties that clear your mucus from your respiratory tract and your nose. Who would know that radish was good? And the things, what fights infection and is a natural antibiotic is garlic. Garlic is very potent in its medicinal properties, and it is, it helps with, it helps protect you from pathogens that invade your body, and it's a very good antibacterial agent. So that would be garlic. And I would just wrap up with those. Those are just foods for thought, for you. So, there are no superfoods that will help protect against COVID. There's no evidence on that, but we can certainly be mindful of what we're eating to make sure that we, keep our immunity strong during this time. Thank you. So be well and be positive, everyone. And I'll take questions at the end. Thank you, Ankita.
Thank you, Ghazala. Thank you for sharing, how we can turn these problem times into a personal growth opportunity for a lifetime. Thank you for sharing all the little tips. Awesome. Now let me take the time to invite Veena.
Thank you, Ankita. Hello, everyone. We all have childhood memories. Before beginning the meal, my grandfather used to say a short prayer. Vadanikava Geta, Namagya Shri Hariche, Sahajavan Hota, Namageta Pukache, Jivana Kare Jivitva, Anna Hech Purna Brahma, Udarabarana Nove, Janije Yagna Karma. Which means before you take a first bite, one expresses gratitude to the higher consciousness. Everything becomes sanctified. Food brings life to essence of life. And eating is not just filling the stomach, but it is the service, yajna. Then it becomes meaningful. So we are going back to the ancient time where the food is treated as medicine. We see more and more wellness centers promoting this. More and more doctors believe in this concept and are publishing books. More scientific research and publications are providing this hypothesis that you are what you eat. COVID-19 has put the world in unprecedented situation. Our perspective has changed. more than ever before, it's a time to reflect upon our lifestyle and our nutritional values for the entire family, especially families with elder people with pre-existing conditions and young kids with the different expectations. This is the time to educate, adapt, and prioritize on what we should eat and how to make this part of new lifestyle for healthy living. This will enable and empower us to fight this deadly disease and overcome fear. I have my first-hand personal experience. By following these simple principles, I have been able to overcome my health issues and avoid major surgery. And I'm not the only one. At ICC Wellness Program, you see the success stories of so many health heroes. First thing comes to everyone's mind when you think about cold, flu, virus is immunity. Having immunity is very important to fight viruses. What is immunity? The immune system is the interactive network of organs, cells, proteins that protect the body from viruses and bacteria or any foreign substances. When the immune system is working properly, you don't even notice it. But today it is the most important to pay attention to. It's when the performance of immune system is compromised that you will face illness. A strong immune system is basis for staying healthy in general and should be year-round strategy, not during the flu season or when there is a threat of novel, previously unknown virus. This is by far the best prevention and protection. More than ever, now it is good time to focus on eating healthy to support immune system. When thinking about immune health or respiratory health, there are two types of foods we should remember: antioxidants and anti-inflammatory. Antioxidants are the important part of overall approach to maintain wellness. For example, respiratory cells can benefit from antioxidant level being high in order to maintain their optimal function. Immune cells can function their best when oxidation stress is well balanced. So also oxidative stress and inflammation beget one another. So to maintain the optimal inflammatory levels, oxidation stress level needs to be in balance. Harvard doctors are saying one of the best way to reduce inflammation lies not in the medicine cabinet, but in the refrigerator. To maintain or improve, many studies show that antioxidant-rich anti-inflammatory meals help reduce inflammation and oxidation. Anti-inflammatory diet is not one of the classic slimming diet for weight loss. It's a diet that aims to reduce inflammatory state of the body. Plants, herbs, beans, minerals, foods, and lifestyle changes can be used to prevent and fight infections due to their antimicrobial and immune boosting properties. For example, both Mediterranean diet and DASH diet includes fruits and vegetables and fish, whole wheat grain, and fat that are good for the immune system. Here are a few steps if you would like to start this diet. I would suggest take a few small steps. Okay, talk to whole family and get everyone to agree and put together a simple meal plan. Commit for at least 2 weeks to start with. Educate everyone do's and don'ts. Involve everyone to find one recipe that they like. You could modify recipes to your likings. For example, if hummus is a bland, add cilantro and green chilies to it. And eat with crunchy, yummy broccoli, carrots, or romaine lettuce as you wish. Add 3 vegetables to each meal. Crunchy vegetables like bell peppers, broccoli, cauliflower, leafy vegetables, spinach, kale, like root vegetables, sweet potatoes, carrots, onions, and so on. Include probiotics. And if you are vegan, there are so many probiotics on shelf: coconut yogurt, kimchi, kimchi, miso, many more. And I have one fruit between meals with some nuts or seeds, especially pumpkin seeds, which has zinc, and zinc helps immune system fight off invading bacteria and viruses. And hydration is very important. Try to have half a cup of water every hour. And lifestyles, Ghazala, you did a wonderful job on explaining lifestyles. I would just add one thing is to going through this much stress, please attend Sachin's meditation classes. They are so powerful. Just it calms down, and he's providing almost every day. And doing exercise and the hobbies, you can just read a book to calm yourself. Anything that calms you down, that's the best thing. And have a good sleep, and make laughter and gratitude time as a family thing to do every day. Practice every day. That will be nice. And here is my recipe for ginger turmeric tea, and have it for a few times a day. And if you do the recipe, if you can tolerate, add pinch of black pepper to make it effective. If you don't like tea, make it smoothie. Add some more bananas and all these ingredients, and you will make a good smoothie. I would like to end here. Thank you so much for listening. Stay safe, stay healthy.